I am Cordelia Kunzekwenyika. I'm part of a team based in Zimbabwe, in a province called Masvingo, where we are implementing an adolescent health project in a very remote area. I have no conflicts of interest. So, why does it matter for us to be in the rural areas and talking about digital health? There are a lot of barriers, as you know, poor internet, there's stigma. Adolescents in the rural areas are not confident to talk about issues to do with sexual or reproductive health, and they do not have digital tools, because people usually miss those rural areas because there's no market. And so we came up with an idea, which I'm going to present, an offline, adolescent-friendly, private access digital hub. We call it a digital hub or a digital space. We are located in the furthest corner of Zimbabwe, near South Africa, in Masvingo province, in Chiredzi, Zaka, and Bikita. We are in 10 rural hospitals, and 2 of the ones that we have implemented the hub are quite remote areas where there is no internet at all. So we set up an offline server together with the Ministry of Health and aligned with the World Health Organization principles, but most of all, we involved adolescents. So the adolescents were at the center of this innovation. They told us what they wanted, and we gave them what they wanted. And we also involved teachers, we involved nurses, and we actually have a feedback tool which helps us in making sure this hub is of good quality and it is still relevant. We have only started in the past year. In 2024, we launched in one of the facilities that I showed you, and then in 2025, beginning of 2025, we're in the second facility because we're encouraged by the numbers. Our Bota hospital, we started with 73 adolescents. By the end of the year, in only 6 months, we had 488 users. Most of the things that the adolescents were asking for were looking for in the hub, because we loaded information that they asked about using an expert-guided curriculum or modules. And most of the topics that they were asking for were depression, condom use, ASRHR, and contraception methods, the things that you would imagine adolescents would want. And what they were telling us from this pilot, they were saying they were happy that they could ask without people, judging them. So they can ask almost anything. So that feedback feature that I talked about, anyone can look, they can type in, and then there's someone who reads, who is an expert, who answers back, just like an adolescent, like a peer. We also have nurses in there, and this gave them an opportunity to be able to know what adolescents need and to adapt to what adolescents need in health service delivery. Because we are not just in digital health, we are actually trying to improve adolescent service delivery in the rural areas at facility level and in the community. The barriers that we found during this implementation were there were not enough devices because of poverty and the areas that we're working in, and we're also looking for funding to expand on this. But for those who have, they were able to use. So we only provided maybe a tablet each per facility, so the adolescents would have to share. So some of them would think, maybe someone will see what I'm also putting in. But we had peers facilitating this, and we also integrated with schools. So at the moment, as we speak, we now have 2 schools that now has this functionality. So in conclusion, we really think digital hubs are a viable model for underserved population, because an adolescent in the rural areas and an adolescent in the city are the same. They all want to be to be digital. Everyone wants to be private. They do not want to be judged, even if they are receiving services. And it's important to strengthen adolescent demand and engagement. So we are recommending that there is sustainability, improved devices. Power is difficult in Zimbabwe, but we have implemented solar for our servers to be set up, and also to always have technical support at intervals, and to integrate with the schools and health facilities as we have been doing, and also to make sure the adolescents, I think this is the crux of the matter, that adolescent-led governance is promoted, and also that we get their feedbacks. I would like to thank the adolescents, the Minister of Health, everyone who is listening. We say to attenders, thank you, Siyabonga. I'm an athlete, eh? Thank you very much.